music on a Monday.
Yeah.
Let's get a deeper understanding of the virus at the centre of our top story this morning. And we're joined by paediatrician and infectious diseases expert, Dr. Lenny Fuong, who is, of course, in the studio. Lenny, lovely to see you. Happy Monday.
Happy Monday.
Right. Tell us about this ship. Tell us about this virus. People, I mean, there's been a lot of wall-to-wall coverage, but health authorities are saying not too much to worry about.
Yeah, absolutely. So the situation at the moment is that we know that over the weekend the ship has been docked in the Canary Islands, and so there's been a complex mission to, I guess, get everyone safely off the boat and repatriated to their home countries. It sounds like what the situation at the moment is that of the 150 passengers and crew members, we know in terms of numbers there's been 3 confirmed deaths. There have been at least 6 confirmed cases by WHO, which have been confirmed to be the Andes strain of the virus. We know that there are 4 people who are currently hospitalised internationally. And I guess what we are doing at the moment is really sort of going back and tracing some of the steps of perhaps the passengers that came off the boat earlier before the diagnosis was made. So there's this big, I guess, international collaboration at the moment looking into, I guess, where the cases potentially might pop up.
Okay, as you mentioned, 3 people have died, so obviously pretty serious. But can you just explain a bit more remind us of what hantavirus is?
Yeah, of course. So hantavirus is typically a rodent-borne infection. It's transmitted to humans by breathing in infected droplets from infected urine, saliva or droppings. And person-to-person spread is rare. However, the strain that has been picked up and I guess confirmed in this case is the Andes strain, which is the one out of the 50 hantaviruses which is known or has been seen to have person-to-person transmission in the past. I think the thing that we do know that it occurs after really prolonged close contact. So that is reassuring. I think the thing with hantavirus that is, I guess, difficult in terms of this contact tracing exercise is that the incubation period is between 1 and 8 weeks. And so the investigations going back to this first death is that perhaps he may have acquired the infection before getting on the boat or very early in the journey, and so might have been incubating during that time period whilst birdwatching in Argentina. And then the other thing that we know is that when people develop lung symptoms, which is most associated with the Andes virus strain, that the mortality rate is anywhere between 35 to 40%. Unfortunately, no antivirals, no specific treatments, but really that early recognition and then hospitalisation for sort of monitoring and support is important to improve survival.
So, of course, most Australians are not particularly worried about coming into contact with infected Argentinian rats.
Yes.
But there are people who have been on this ship who are going to be coming back to Australia.
That's right.
How worried should countries be about the spread of this virus? Or is it really the case where you really have to be next to someone for a very, very long period of time to actually have something to worry about?
Yeah, so there have been definitely some reports published in the literature about the Andes virus, and what they found is that typically it does require that prolonged close contact. And so there have been lots of stories about people being on flights with infected passengers and what that means for them. I think what's really important is that prolonged close contact and the fact that you have to be symptomatic with the virus to actually pass on infection, which is unlike things like flu, measles, and other respiratory infections. So there is a smaller, tighter window. And in terms of its ability to kind of spread, I guess we've seen over, at least 35 days on the ship that there have been potentially 8 confirmed cases of that 150 odd people. So it's not the most effective virus, which is a good thing. And so we're not expecting that there'd be sort of that global kind of spread in the same way.
What about those reports of a passenger on a Johannesburg flight, may have infected crew?
Yeah,
What's going on there?
Yeah, so there was the woman who was the wife of the first case who unfortunately was on that Johannesburg flight and was unwell. And apparently there was a crew member who perhaps was sort of helping her while she was unwell. She was symptomatic, and as with hantaviruses, unfortunately the early symptoms are just flu-like symptoms. So she had flu-like symptoms, was tested and has subsequently tested negative, which is reassuring.
Yeah.
Obviously people will still be watching her because of that incubation period, as with any other people who have been on that flight.
How much better prepared are we as a nation to deal with these sorts of outbreaks? Because people say it's not if we'll get another pandemic. The question is when. Are we better now than we were before COVID, do you think?
Yeah, I think that's been the one positive highlight from COVID, or the positive side of COVID infections, that now we have systems in place, so we're better able to control. So there's better border security in terms of infection control prevention. The hospitals are better equipped in terms of infection prevention precautions. So we have kind of protocols in place, and there is better sort of coordination across sort of international, borders. WHO, CDC, the European nations, and also all the health authorities have been working really closely together. There's probably better, clearer messaging as well that's able to be put out. I think that's all kind of come because of COVID and what we experienced.
What about for the Australian passengers? We know there's Australian citizens,
Yes.
permanent resident, a New Zealand citizen who's coming back to Australia. Do we know exactly what's going on? Because we spoke to the government, they're still working things out.
Yes, so as far as reports of in the media have mentioned, apparently they are for a Perth-bound flight. So all passengers that have come off the Hondius have had screening whilst on the ship, and then they'll get on a non-commercial flight. So this is a Perth-bound flight. They'll be quarantined for a period of time. I think that's still to be determined. And then they'll probably sit out an isolation period of up to 8 weeks, which is to make sure it is a long time to make sure that nothing develops. And hopefully this is all precautionary, and that in 8 weeks' time we say, we did more than we needed to. But I think until that point, people are obviously going to be a little bit more cautious.
Lenny, we always appreciate having you on. Thank you.
Pleasure. Thank you.
There you go. Fingers crossed we don't hear about this virus for too much longer. Now, a new First Peoples exhibition in Melbourne is showcasing the works of prisoners and